Oh, it's one of our favorite weekly segments. It is a Men's Health Monday to help us talk about men's health and health in general, really. Dr. Michael Lutz, president of the Men's Health Foundation, Michigan Men's Health Foundation. Dr. Lutz, how you doing on this Monday?
It is beautiful out.
Is it not? I mean, it's this weather. I don't think you can beat it in October.
It's warmer outside than in the studio right now.
I know. I had the studio a little colder today. It's a little I did turn it up though, so hopefully by the end of this time, by the time you leave, hopefully it'll be warmer for you.
I'm already feeling the heat.
Okay, good. Dr. Lutz, let's talk about a couple of things here. First and foremost, we mentioned it a couple of weeks ago, but the seasonal affective disorder that people will perhaps experience here, we're changing the clocks back. We are falling back on Saturday night, Sunday morning, depending upon which way you look at it. We are going to wake up in darkness, come home in darkness. There's going to be a lot of that and a lot of lack of light. What kind of effects will that have on people?
Well, my wife and I voted, and we decided this is the worst one.
Yeah,
we hate
no
this
doubt.
one. We hate this one. So there's a couple of things you can do to make this easier on you, because it's all about your circadian rhythm, what your own biological clock is used to. And the best thing to do is start to adjust your sleep schedule. Make it about 10, 15 minutes a day. Move that alarm clock up so that by the time that it hits Sunday, make sure you set your alarm and get up at an earlier time. And as soon as you get up, get out and get some sunlight as quickly as possible to start that biologic clock. So sit next to a window if it's sunny out that day. If it isn't sunny, get a light box and get that started. But there's things that you should do. But maximize your light exposure, get physical, and also watch your diet. That's the thing, is don't eat lots of carbs. That's really not good for adjusting your biological clock. Get a routine started, and then try and stay socially connected, not only that day, but for several days later on, so that you have that nice rhythm going in life.
Because it can beat you down unless you really do a couple of things to get yourself out of this. I mean, it's going to be, you might be driving home from work at 4:30 and have it starting to be dark outside.
Yeah, having your headlights on is going to be rough.
Yeah, 4:45 p.m. headlights on, not great. And about how long will it take you to get used to that change in the clock?
It'll probably just be a couple of days if you do something proactively. So like starting about 2-3 days before the time change is start moving your alarm clock up, and then set a routine for that day on Sunday, and then follow some of the hints that we just gave.
Be proactive. That is absolutely good advice, because if you don't, you could really allow yourself to get bogged down. All right, changing topics now. Wanted to talk about concussions and CTE. So many people hear those words, and they may only think of them in the context of football players, but that is not the case.
No, I mean, we always think of brain injury, traumatic brain injury as a football thing, but it can happen almost in any sport and also in daily living. Mine was in a car accident once, and I had a traumatic brain injury.
So talk to me about that. What is that like to experience a concussion? How do you know? Maybe you fall down and hit your head. How do you know if you are concussed?
Well, for me, it was a loss of consciousness. But
wow.
But for most people, it's not like that. For most people, is they'll hit their head and they think they're fine. But you may not be. And so it's really important that if you had mild traumatic brain injury, is to get assessed. And it's really important to do it if you had a headache, if you've developed some dizziness, confusion, nausea, vomiting, or if you've developed some sensitivity to light. These may be warning signs that you've suffered a concussion.
And, it can happen quickly. Like I said, obviously a car accident for sure, but just a slip and fall. Maybe it's icy outside coming up and you hit your head. And
hit your head on the back of your head on the sidewalk. Yeah, you don't even know it.
Really dangerous. Now, what would be your advice? Is it to go to the ER, get checked out there?
Get immediately checked out. And they could do some testing. Like you'll even watch in a football game, you'll see they do quick tests. They have these 2-minute tests that they can do to football players to see did they suffer a concussion or not. And there's the same thing that they can do for you if you go to the emergency room to get an assessment to see if you've suffered a concussion. There are little hints. Eye movement is a very subtle hint. your speech pattern, memory. So there's a lot of things that they can quickly do to do a quick assessment.
And one of the things, and correct me if I'm wrong, when just in my football playing days, I always was told not to fall asleep. Don't go to sleep if you feel like you have a concussion.
Well, whenever somebody has a head injury, they want to make sure that you don't go out completely. And so they want to do what they call neurological checks on a periodic basis just to make sure that you're doing okay.
The CTE part of it, that was new. Now, that was something that I started to hear about in relation to football players. Do non-football players get CTE from brain injuries like that?
They can if they've had repetitive head injuries. And unfortunately or fortunately, the CTE is a diagnosis after life. They can't really make that diagnosis until they actually analyze your brain pathologically. And they've done studies on football players, and they show that 96% of NFL football players have had CTE.
And what are some of the, if you have it, what are some of the behaviors? What are some of the problems with it?
Significant neurologic decline.
Yeah.
And so the things that they've done, in fact, football, interestingly, is they've actually reduced the number of concussions. This year, 2024, which is the last year of data, had the lowest number of concussions since they started measuring concussion history in the NFL, 182, down from 219. So the numbers are getting better. They're improving the equipment. They've improved some of the rules to reduce the risk of concussions in football. They have much stricter concussion protocols and when a player can come back to play. And they're also educating players. So hopefully this will translate into lower rates of CTE or chronic traumatic encephalopathy going down the road.
We see some of these helmets that these athletes are wearing. I mean, it is, they look completely different in many cases, just with the different grooves. The science behind the helmets and the manufacturing has improved so great over the years.
Yeah, there's a great podcast on the history of the NFL, and it all started in college football, and these guys wore nothing.
Wow.
No pads, no helmets, and people died. So I think we've come a long way.
No doubt about it. All right, last topic here in the remaining time. The importance, and I think I will mention this to you every time I see you, the importance of stretching. When you get up in the morning, maybe before you go to bed, especially in the cold weather, how important is stretching?
I wish I practiced what I preach, but
I know I am with you. I am with you, Doc.
I'm the world's worst.
No, well then I'll be your vice worst stretcher. If you're the president of the worst stretching club, I will be your vice president. I need to stretch more.
Me too, and it really is important because
so many benefits.
Even the anticipation of exercise, believe it or not, improves the blood flow to your muscles.
I mean, it's
so getting ready for exercises, anticipation. Get ready for it. Start some stretching, and get a little warmed up, and you'll be ready to go.
I mean, I feel like a good stretch, and I'll be ready to run out of this studio, do a couple of laps in the commercial break.
I'm going for a run.
You can find Doc, Michigan Men's Health Foundation, 760 WJR. Oh, my God.
I am going for a run.
Are you?
But